WBA employs 36,000 pharmacists, many located in communities where access to healthcare is limited. They provide a vital frontline service to people around the world, not just this year, but even in years past. Joining us now are two incredible pharmacists I want you to meet, Stephen Fadewale from Walgreens and Bhavika Mistry from Boots. Thank you both for joining us. We're so grateful for your time. Bhavika, I want to start with you. You're coming to us from Halifax. What are some of the challenges that you've had to face under COVID?
So since the pandemic hit, we've faced many challenges. So a lot of the GPs shut their doors. So we were the forefront of healthcare in England. So people came to us for their healthcare need. We had lots of vulnerable people in our local communities that didn't have a support network. And we were relied upon to deliver them their medication. We delivered them essential things just to make sure that they had everything they needed in this time of uncertainty. So we went out of our way, had to change what we did to deal with what was in front of us. And it changed day by day. But we used the local community and ourselves to support them in any way that we could.
Stephen, what about you? You're coming to us from Chicago. How have you had to rethink things, and what are the challenges you faced?
I think the biggest thing for us in Chicago is meeting the community where it needed us the most. Our zip code is actually one of the most hardest hit zip codes with the coronavirus. And in addition to that, we're also an underserved community in Chatham of Chicago. And being able to also provide testing is also one of the things that we've also been able to gather around of. I think the biggest thing was having a testing at the store where if a patient comes to pick up a medication, they could leave the store, go into the drive-thru, and also get tested. And you also have to think about the role of a pharmacist, where that person in the community where the patients come into to answer questions. Of course, when you have severe symptoms from the COVID, you should go to the emergency room. But if you have moderate to mild symptoms, the first place that you go to come to is the pharmacist. So just being able to rise up to the challenge that happened and just being able to meet the patients is where they needed us the most.
Bhavika, I want to talk to you a little bit more about testing and for people coming in also for vaccines. How has that changed your role as a pharmacist?
So I've come from my pharmacy to help pilot the first COVID vaccination centre in a Boots pharmacy in England. So we've got a store located in an area, got it up and running, created a section that's suitable for vulnerable people to come in and out of within a store setting to get their vaccination done. So it's in the heart of their community. It's where they know it's a local store, it's accessible to everyone. And we've had that up and running within a few weeks. So we've been running since the beginning of January, and we've had over 200 people walk through our doors every day. So some of the stories that I've got to tell. So we've had the eldest person we've seen is a 102-year-old lady that came through our doors. We've had 90-year-old twins, and they're so grateful for the service that we're providing because it is on their doorstep. They can come in and get that vaccination from the people that they trust, that we've been there throughout the pandemic. And the emotion that we see, so them being able to access this vaccine has given them that hope that they can go back to a normal life, that they can see their family and friends, and they'll be able to get out again, because some of these people have been stuck at home. We've had so many people in tears with just how grateful they are for the services that we are providing, and the fact that we can roll this out to other Boots stores throughout England is amazing. So it's accessible everywhere throughout the country for all these people to get vaccinated, and hopefully we'll get this new normal.
And the new normal is exactly right. Stephen, I want to talk to you also. You're a shining example of how the role of the pharmacist has been revolutionized. You had to face the George Floyd protests. How did that change how you operated?
It was devastating to see a store that, you've literally worked and, you've built up to a high standard, being destroyed. But the good thing about it was we were able to take it and help that become a pinnacle or an example to how resilient that we are in the community. And think about it, our store was one of the few stores to open back up real fast. And those stores that couldn't open back up, we had to set up mobile clinics. Now that's big when you think about the infrastructure that it takes to set up a pharmacy. And within a week to 2 weeks, we had those mobile clinics that were opened up. And think about it also, you have patients who in my community also have a high prevalence of diabetes. So because of the fact that we were the few stores to open up, you had other stores or other companies who couldn't open up in the neighborhood. So we had patients that were coming to pick up their medications, but in addition to that, we were open. So because of the fact that we're a food desert, you have our store being able to receive those patients and also help those patients out. And then also you also have to think about ways that we've been able to adapt and change some of the way that we operate. Like, for example, starting up the Health Outcomes Initiative, where we're able to provide more accessibility to patients with the medications. And guess what we started doing? We started delivering those medications out to the patients, making sure that the patients are able to get that medication when they need it the most.
That is just incredible. Thank you both, Bhavika and Stephen, for your personal touch and seeing this through the eyes of the pharmacists, this pandemic. Thank you very much.
Thank you.